lips, lip service, lip slap. No matter what the cliche, our lips have a lot to do with how we express ourselves and how we look. But time can take its toll. Dr. Bill Johnson of Innovations Medical knows how to keep our lips looking full and youthful. Dr. Bill, how are you?
Good morning. Great.
Why do we get thin in all the wrong places as we get older?
Boy, it does seem to be true, doesn't it? Yeah, that's one of the things that really does happen with our lips. Lips are really bad about losing volume. And when we lose volume, we lose fat predominantly out of our lips. That's when we get the creases and the lines, and then we get the muscular action going around our mouth, and we get these deep folds called nasolabial folds, and the lines that can come down from the corners of our mouth, which we call marionette lines after the puppets.
That's a good line to say. And we notice a lot of these in celebrities too. You know, if you look at them over time, you see kind of the progression of their mouth as well, and how, you know, she's a perfect example, Mary Tyler Moore.
Very, very much so, of how nice full lips when they're younger. And here's Julia Roberts, who you wouldn't think of, but you look at her when she was young, and even now, even though she has nice full lips still, they're just not as full, and they have creases that weren't there. And here's a person you really don't think of, but you can notice it on Halle Berry, where when you look at her when she was a young Miss USA, she had very full lips, and now, even though still very attractive lips, you can still see where she's lost volume and is getting some creases and lines. All
right, well, that's the bad news, but you're here with the good news, because we can do something. Let's start with the creases and the lines. How do we get rid of that?
Well, one of the good places to start is laser resurfacing, because we can do that in the office. It's great for removing a lot of the superficial creases and lines, and it does it by giving us a new surface. That's why we call it resurfacing. So we get a new fresh look to the skin there as well. So it's a real nice place to start.
Okay, so once we get rid of those creases, those lines, we want to make them a little bit more voluminous. How do we do that?
Well, the classic place on that is the fillers like Restylane and Juvederm. And they work really well. And a lot of folks in the past have gotten a little shy because it got popular a few years ago to overfill and to get this duck lip look. And
duck lips, not cute.
Yeah, and we've gone away from that now. And now the idea is to restore the volume to where your lips were when you were 20, so that we make your lips look like your lips. The fillers last for about 6 to 12 months, and it does take a needle, so we do numb you beforehand, but really no real downtime. You can get a little swelling and rarely some bruising afterwards, but it's pretty simple to do.
So if you're like me and you want no needle, no downtime, then is there an option for someone like me?
The tall order, the person that wants no needle, no downtime. Really there is. Thermage makes a specific lip tip. Now it's different from the face tip, but the Thermage lip tip really can give the appearance of fullness and can really help reduce some lines in less than an hour, really, with no downtime afterwards and no needles involved.
We like that. What would be the ultimate treatment for the lips? Let's take a look at that.
I really think the ultimate treatment for the lips is fat transfer. And we can come in and take fat from wherever. The inner knees is a real popular place. And here's a great example where we've come in and restored the lips very much to what she had when she was 20. And this is a long-standing result, because this lasts for many years.
That's your fat transfer. Why do we have fat knees when we want our lips to be fatter? This is just the universe not really working with us, but Dr. Bill can step in, intervene, and put the fat where it should be. GMT special, you always have one.
Yeah, we're going to take 10% for the next 2 weeks off of any lip treatment for folks that want to have their lips restored.
Awesome. Dr. Bill Johnson, thank you for being here. And for more information, log on to innovationsmedical.com or call 972-331-8844 for a consultation. And if you have a question for Dr. Bill Johnson, drop him an email at questions@innovationsmedical.com.